I wanted to go over with you my routine with my exercises, because exercise, honestly, the only thing I like to do is play racket sports. But when I'm at home and I don't have time to go to the gym and play pickleball, I do a daily routine. And honestly, I don't like to do those, but I found things that benefit me so much to help reverse my aging if I'm accelerated in my aging, which I believe I was. I was 49 and checked my biological age, and I was 62, and that shocked me. So I went on a health plan for reversing my age, and now I'm averaging around 63, 62 years old. I've reversed about 13 years in my biological age, and so I'm actually my age, which is 62. Before I was accelerated aging at 62 years old when I was 49. So there's things that I've learned in the meantime how to take care of your health, and I'm always in process of discovery, as you are. And I like to discover things. I like to research things, and I like to experiment on different things. And when I notice something benefit my body, I log it down. I try to log as much as I can, because I try a lot of different things, and I'm asking my patients to do certain things that are set in stone, like blood work and what to do with blood work, and hair analysis for heavy metals and what to do with that. Those are pretty much set in stone the way I do it. But then um, along the way, I learned how to improve things. And one of the things that I've learned in my techniques is acupressure. But in this particular case, it's a book called Touch for Health. And I would encourage you to get this book. If you want to learn how to do it for yourself, get this book, okay? Because it gives you a big reference on using acupressure points to help heal your body. And you could do that with muscle testing yourself. But this routine, you don't have to muscle test. If you want to go to my site on drkwik.com, you can look up what muscle testing is. I believe that's a valuable tool for you and your family, so you can have less doctor visits. Treat your own family, get them healthier. I always recommend this with lab testing, because lab testing is critical to understanding the Western part of medicine, which is checking your blood. The life is in the blood, the Bible says. You can actually look at blood findings to see if you need vitamin B12, folate. Do you need digestive enzymes? Do you need kidney support? Do you need liver support? Do you need immune support? And those things you can check. You need protein, digestive protein, digestive enzymes. So those are the lab testing from a nutritional functional nutrition, functional health, functional medicine perspective. But this part here is more of an Eastern perspective that was discovered by Dr. Goodhart, and he learned muscle testing has an effect that can give you immediate findings on your body right now. For example, if I put my phone that's unprotected next to my body without my EMF protection that we sell at this office, and I'm very biased, I'll tell you right now, I love these products. EMF is a new problem, and we can look at my videos in my blog to research that out. But when I put an unprotected phone next to me, I will weaken my muscle. It will weaken. You can do this on your own, and you can practice this on your own. And so muscle testing is a valuable tool. But this just uses the meridians, and that I will show you right now how I do this, called the meridian dance. There's lines of energy on our body that go up and down from head to toe, finger to head. So basically there's these 14 major meridians, and I'm going to move the muscle that is associated with that meridian. For example, this meridian here is called the supraspinatus muscle. When you push like this down in this direction, that's a supraspinatus muscle, which is related to the central meridian that goes up to your lips, right through here, from pubic bone to the lips. I tested two major meridians first. The central meridian here, central meridian up the back, called um, the uh, the governing vessel. This is called the conception vessel. And when the governing vessel is so popular in chiropractic circles, because we treat the governing vessel all the time with our spine when we adjust the spine. So that's the second meridian, and those are the top two because they're in the center of our body and they go to other parts and affect other things. So the supraspinatus muscle is like this, and I just do this motion 10 times like this. I'm going to do this right now with you. And then we have the teres major, which is kind of like the chicken wings. That's the teres major muscle. And you do that 10 times. Go forward and backwards and slowly if you can. If you're in a rush, you can go quicker. I take deep breaths when I'm doing it. Okay. And then this is the stomach meridian, or the pectoralis major muscles. Pectoralis major clavicular. Okay, you do that 10 times. Keep your shoulders down. And then you go to the latissimus dorsi. Keep your elbows straight. That's your latissimus dorsi, or your spleen meridian. And there's all in this book right here. Okay. And then you go to the small intestine meridian and the low. Go to the heart meridian, which is like this. Shoulders down, elbows up, and you go back and forth like this 10 times. If you notice that one muscle is weaker than the other, focus on that one and do more. Maybe pain or discomfort. Obviously, you don't want to make things worse, so be careful about increasing, exercise that causes pain. Just back off a little bit. But for example, I'm noticing more in my left shoulder because I've had a history of frozen shoulder, and so I worked on that muscle. Or I could feel more fatigued on one side. That's important as well. So this is the heart meridian. Okay. And again, these are related to the spinal nerves that connect to your heart. That muscle right here, called the teres minor, goes to, I'm not teres minor, it's the, blanking out on the name of the muscle for the heart. The teres subscapularis, sorry about that. So this is the subscapularis that attaches to your shoulder deep inside and attaches to your scapula deep inside back here. And that's surrounding the heart. And that is also related to the spinal nerve. That's T2, T3. So it's all related. T2, T3. If you adjust T2, T3, it'll affect this heart meridian that goes to the subscapularis as well. Okay, so that's heart. Then the next one is small intestine. So I like to do cross crawls and lift your knee up as high as you can. And that will, now you're starting to breathe now because you're moving your legs. I do 10 on each side. Okay. Go as high as you can and cross with it. Touch your elbow to your opposite knee. And the next one is your bladder meridian, which attaches to your side of your leg, called the, I'm blanking out on the names again. Bladder meridian is the posterior tibial muscle and the peroneus. The peroneus is the major one. It causes your foot to go, your right foot to go out. You bend your foot out like this and up. So it's to the side and up. And that's your peroneus muscle. And this one, I like to combine movements. So if you're just moving your leg, I'm moving my leg like this, up and to the right, up on my right side, and I just go like this. I just keep going on my other exercises. Keep your upper ones moving, and do 10 on that right peroneus muscle in the leg. Okay? And then do the other side, up and to the right, in this case, up and to the left. I'm just moving my upper arm as I'm doing and keep your knees straight when you're doing this, so you can feel a little of a stretch of your gastrocnemius, which is your calf muscle. Keep taking deep breaths. And the next one, that was a bladder meridian for the peroneus. Next one is the kidney, which is the psoas muscle right here. Attaches to the back, and a lot of people get pain in the back because of this muscle. So the way you exercise this muscle is you go out with your leg, and the meridians are bilateral, by the way, except for that first two that I mentioned down the center. Psoas is the kidney meridian. So what I'm doing is lifting up, turning my toe out, and lifting up like this. Keep your knee straight, and then, so I'll go like this. Keep the knee straight as much as you can. Feel that stretch on your hamstring. Turn your toe out. Do 10 on each side. So this cross crawl mechanism is awesome. Notice I'm breathing a little more because I'm exercising my leg. So This is great calisthenics. Well, that's your kidney meridian. Next meridian is your circulation meridian. Still working on the legs. Controls the gluteus medius. Again, you're going to stretch out this part, strengthen this part. You notice one part that's weaker than the other. Just focus on the next treatment or the next day that you're going to do the meridian dance. Bring it all the way up so you feel that stretch on the bottom, and you're going to start to feel the gluteus medius start to fatigue. And if you notice one side, notice I was bending this way when I was doing that. You don't want to do that. Stay upright and lift up the leg. And this is great for balance. See how I lost my balance? If you do this, now if you tend to have tendency to fall, obviously you're going to have to hold something here. But I'm getting tired because this is a weak muscle for me. Okay, so I did my gluteus medius, hold on to something. If you don't have to hold on to something, great, because that means your balance is pretty good. Work on your balance. I'm 62. People fall when they get older. They break a bone. Sometimes that's the end of their life because they have to have major surgery because they broke their hip and their health goes down the tubes. So keep practicing on balancing on one leg. Start, holding on to something. If you tend to have a tendency not to balance correctly, hold on while you're doing this. And then when you get good, you don't have to balance yourself on anything because your balance is good. And you can have good balance for the rest of your life. The next one is a triple warmer. Now we're moving to the upper arm now, upper extremity. This controls your warmer is kind of like your whole metabolism in your body. Triple warmer is basically controlling metabolism, has a lot of different functions. This is the teres minor muscle. And this book will help to explain also some nutrients that could be deficient when this muscle is weak. So this is called the triple warmer muscle. And then the next muscle will be the gallbladder muscle. And that's your deltoid. You go like this, and when one of them is weak, it could be related to the gallbladder meridian. It doesn't say that you have a gallbladder problem, but in my case, I had almost lost my gallbladder. This is an important one to do. And then the gallbladder is associated with the liver because they're right near each other. They're kind of working hand in hand. The liver is like this, turn in and out like this at a 45-degree angle. We do 10 of those. And then right after the liver, we're going to do the lung. Okay. And again, if you feel weak on one side, focus on that side. Do maybe more reps on that side. I'm going to go straight into the lungs. So I like to do this. You're going to reach for that upper corner, 45 degrees up, and reach forward. So you're pulling that scapula forward, and you lift. Reach forward, lift. Reach forward, lift. I get weak on this one, so I do more reps. I'm only going to show you a few because I want to finish this. And then lung, this is your lung. So I find this sometimes go bad when they have sickness, right? When they're sick with a cold, this muscle can go weak. Okay, and the last one is large intestine, back down to the leg. So this one is on the side, the TFL muscle right here. TFL, you're going to bring it out to the front. At front, 45 degrees, turn your toe in, and then lift that direction. Okay, so again, I'm trying not to balance myself on anything except my left leg. But if you need to balance on a piece of arm on your wall, make sure you don't fall. And so now I'm going to combine. I'm going to go like this. I'm going to do cross crawl. Toe in, toe in, toe in, toe in, toe in. Breathe. Keep your knees straight. Feel a good stretch on that muscle. In this case, it would be the bottom muscle. You're feeling a stretch. And then you're really feeling this muscle contract and it gets fatigued. Toe in. That is the whole 14 muscle protocol. Notice how I'm breathing a little bit more. And it's a great, great exercise. And I would encourage you to get that book.